Hello, I'm Kristen and I'm a kinesiologist here. What we're going to go over is week 6 to 9 of a post-hip replacement exercises. So the goal at the end of these few weeks is for you to be able to walk longer with the assistance of a cane so we can avoid walking with a limp. We're going to get you to do a sit to stand with the support of your hands if you need. And we're going to be able to get you to climb up and down the stairs with assistance, whether it be with a cane or your hands. And then the goal is hopefully getting you back to work or volunteering, but depending on what your doctor recommends. So first exercise we're going to go over is a bent knee lift. So what you're going to do is you're going to lay onto your bed, onto your back, both knees bent. From here, you're going to engage your core. As you engage your core, you're going to lift one leg. We are going to alternate, lifting one leg up to 90 degrees and then back down. And then you can relax your core. Re-engage, lift the other leg, and back down. And we're going to try and avoid any arching into our back. So we're going to engage that core, lift your leg, back down, re-engage that core, lift, and back down. And we are going to repeat this 6 to 8 times once a day. Next exercise we're going to do is a bent knee pull apart. So you're going to be lying on your bed again. You are going to need an elastic band. You are then going to wrap your elastic band around your knees, tie it in a knot, and it's going to be right above your knees. From here, your feet and knees are going to start together, and you're going to engage your core and pull both knees apart and nice and controlled back. And we're going to do that a couple times. You can also alternate each side. So one leg stays, the other leg drops out. Again, keeping that core engaged. And we're going to repeat this 8 to 15 times, 3 times a week. Next exercise we're going to go over is a wall slide. So you're going to stand up against a wall. Your feet are going to be about a couple feet away from the wall, just so we don't have an uncomfortable arch in our back. And your feet are going to start at shoulder width apart. Hands are going to be on your hips, just so we can feel that core engaged. As you engage that core, we're going to bend our knees just to about 45 degrees, not fully sitting into a chair. And then you're going to squeeze your bum as you slide up. And we're going to do that 8 to 15 times. Little bend in the knee, squeeze your bum standing up, pushing against the wall, and back down. So 8 to 15 times, 3 times a week. Next exercise we're going to go over is a leg push against a wall. So you're going to be standing on your non-operative leg. So the one that's been operated on is going to be bent and lifted up against the wall. So just up to about 45 to 60 degrees. From here, what you're going to do is you can have your arms across your chest or hands just hanging off the side. And you're going to press into the wall with your operative leg for 6 seconds. Press, 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 hold, 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 and back down. Okay, and we're going to repeat that 8 to 15 times. Press and hold for 6 seconds and back down. And we're going to repeat that 3 times a week. Next exercise we're going to cover is balancing on one leg. So this is going to prepare you for starting to go up the stairs. So you're going to be using a supportive structure. So whether that be a wall, a countertop, a really sturdy chair, whatever you have lying around. You're also going to have a block, a phone book, or some sort of stool on the floor. Nothing too high. And then from here, what you're going to do is having your hands on your supportive structure. You're going to lift your leg, tap it on the block, and back down. And we're going to alternate each sides. And we're going to be repeating each side 8 to 15 times. Okay, lifting one leg, always making sure that core is engaged as well, and back down. So 8 to 15 times, 3 times a week. Last exercise we're going to go over is a sit to stand. So you are going to need your elastic again. Same thing, you're going to wrap it around your legs, tie it in a nice little knot. Okay. You are then going to sit on a chair and you are going to have a cushion. So whether that be a couch cushion or a pillow, something that is going to lift your bum up so that we're not at 90 degrees just yet for our hips. Now from here, what we're going to do is you're going to engage your core, and as you stand up, you're going to think about squeezing your bum nice and tight. So slight lean forward, push through the floor, through those feet, standing up and squeezing your bum. With the elastic band, making sure that elastic band is staying apart and those knees are not coming together, okay? So knees apart, core engaged, pushing through that floor to stand up, squeezing your bum, and sitting back down. And we're going to repeat that 8 to 15 times, 3 times a week.